I'm going to explain how to perform a pelvic floor contraction. Your pelvic floor muscles are a group of muscles that sit like a sling at the bottom of your pelvis. They stretch from the front at your pubic bone to the back at your tailbone and side to side between your sit bones. They essentially form the floor that support your pelvic organs, which are your bladder, rectum, prostate in men, and uterus in women. They're also responsible for many other bodily functions like sexual function, core stability, and bladder and bowel control. Now, since your pelvic floor muscles are all internal muscles, externally you should not see much movement when you activate them. However, internally you should feel a subtle contraction. I'm now going to talk you through how to perform a pelvic floor contraction. Then I will demonstrate a few positions you can perform the pelvic floor contractions in. I want you to take a natural breath in, breathe all the way out, gently draw in and up through your pelvic floor. An analogy I like to use is, imagine you have a tampon inserted and you're trying to gently draw it in and up, hold, and relax. Another analogy you can use is, imagine you're trying to hold in a wee, hold it, and relax. Remember, we're only looking for a subtle contraction. Harder is not better when it comes to the pelvic floor. And a few things that we want to avoid is tensing the body, holding your breath, and squeezing the glutes throughout. Remember to exhale to contract and inhale to relax, and then repeat for desired repetitions.
An easy position to begin with is lying on your back with your chin slightly tucked and shoulders relaxed. Your legs are bent and your feet should be about hip width apart, and your spine should have a nice neutral alignment. From here, you would perform your pelvic floor activations like we spoke about before by taking a natural breath in, breathe all the way out, gently draw in and up through your pelvic floor, holding and relaxing.
If you are pregnant, a better alternative would be to complete in the side lying position. Grab a pillow for comfort, and then your hips, knees, and ankles should be stacked on top of each other with your legs bent at roughly 90-degree angle. Your spine should also be in a nice neutral alignment. From here, you would perform your pelvic floor contractions just like we spoke about before. A few other common positions to perform your pelvic floor contractions in include sitting, standing, and on all fours. I would encourage you to try different positions to find which one works best for you. And there you have it. That's the right way to activate through your pelvic floor.